We'll bear with this one moment. I see still people getting on. We're up to 106, 7, 8 now. We're almost there.
William, I'm just going to go ahead and record it as we have been. I'm just going to go ahead and post it after we're finished.
That sounds great, Jim.
Okay, great. Okay, so you are good to go, sir.
Good to go. Hey, welcome everybody. Tonight is going to be really special. My name is William Friedman. I'm from Sandpoint, Idaho, and this is Mr. Jim Glenn and Ann Glenn from San Antonio, Texas will be your host tonight. Thanks for being with us. We're happy to have you. Thanks for giving up part of your Friday night to be with us. That's awesome. I'd like to send a special welcome to all of our new guests that are here tonight, perhaps for the very first time. I promise you, we will not disappoint. This is our ASEA broadcast where we bring interesting and unique perspectives about the science of ASEA, the business of ASEA, and real life-changing experiences to all of you. Tonight's guests are the amazing Dr. Robertson Ward, MD. This is the Redox Doc, guys. And Dr. Robertson Ward is from Nephi, Utah. I think I got that right. Dr. Ward is board certified in family medicine with advanced training in bioidentical hormone treatment, functional medicine, and addiction medicine, and has an interest in holistic medicine. He also has advanced training in functional medicine, which applies principles of natural remedies to traditional medicine. That's pretty neat. He is an acclaimed community medicine physician and researcher. Dr. Ward has directed over 15 full clinical research studies and is an expert in the science of redox signaling. So first off, let's go to Dr. Robertson Ward. Welcome, Dr. Ward.
Thank you. Good to be with you tonight.
Fantastic. You know, we're so, we have probably the biggest crowd we've ever had. I want you to know that. And we're all super excited to have you with us tonight. And we look forward to hearing more about your views and your thoughts on the power of redox signaling, because we know you as the Redox Doc. So, Dr. Ward, if you don't mind starting, tell us about your interest in creating the website, the Redox Doc.
Well, so a number of years ago, the ASEA Corporation asked if I would take on a role as a science teacher and teach about the science of redox chemistry. And I said, sure, I'd love to. And that led to the development of the website and the documents that it contains. And really, redox chemistry is, probably 20, 30 years old as a theoretical science. And it's not something that we're commonly aware of. It still today is somewhat of an esoteric part of biochemistry, but it is seeping its way into mainstream medicine as researchers are looking for foundational therapies to assist us as we go through life, because we don't always stay in balance. And as we wander off course, many times the most fundamental or foundational way to restore balance to our bodies and our biochemistry is to figure out how to restore balance to our redox potential. And so that's why it's exciting and ever more prevalent in medicine and in biochemistry and the halls of universities. So
fantastic. And I know also you're an author. Would you tell us about perhaps your latest book that you've written about redox?
Okay, so in 2017, I published this book, Healthy Cells, Healthy Life, and it's a kind of an overview of what is redox chemistry, how does it affect our health, and I walk through several body systems and actual medical conditions and how there's a connection to our redox potential. And so I'm in the middle of writing another book that connects the dots between nutrition and our redox cellular health and the way in which supplementing our health in the presence of a balanced redox potential has immensely important ramifications. So hopefully we'll have that ready in about September this year. So
That's pretty exciting stuff. Hey, did you mind giving us just a little sneak peek of what that might look like when we understand the connection there?
Yeah. So the first question that came to my mind as I was learning about this back in 2010 is, what is a redox molecule? And the only thing I could remember was basically back in biochemistry in college. And we knew that when we have in a cell, mitochondria, for example, when they burn fuel or food and turn it into energy, ATP for the cell, there were redox molecules created in that process that we thought were just kind of a waste product or unimportant. Turns out they're critical. Without these molecules, our cells don't work. And these molecules are produced in a balanced way. They're produced in some cells, millions of molecules per second. It's pretty hard to conceive.
Wow.
And they're used a million times or more in the same second. So they're fleeting molecules that are produced and used for the purpose of maintaining and providing completion of various chemical reactions. In fact, in our bodies, in all mammals, in fact, in all cellular organisms, there is no more important foundational components to support our biochemistry than the completion of oxidation and reduction reactions, which require the presence of these reactive molecules. So what are these molecules? They're basically little tiny molecules that are made out of various atoms, including oxygen, hydrogen, chloride, and they are made in our cells when we're healthy in balanced ways. And if we're not in balance, they're produced and used and create an imbalance, which the cell must figure out a way to solve or correct. So they are produced and used, and in every cellular reaction, they are needed. And so we just need to be sure that we have an opportunity to make sure that they're produced, and that will create what we call a redox potential. And when we have a vibrant, strong redox potential, we engage in having vibrant health.
That's fantastic. And so when we're young, we have a stronger redox potential than as we age, correct?
Yeah, it's true. And the problem with that is an inherent issue in our bodies, and that is, as we age, we have fewer mitochondria to the tune of about 10% less per decade after the age of 20. So 10% loss per decade, percentage-wise, and the efficiency of our mitochondria to produce energy and reactive molecules is reduced also by about 10% per decade. So it's kind of just one of those things. That's why qualifying times for marathons go down in very fit athletes, because we just don't have the cellular efficiency that we had in our youth. So there's only two ways to combat that battle. One is to exercise. And when we exercise, we create more strong muscles, dense muscles, where many of our mitochondria reside in our muscle tissues. And the only other way to fortify our redox potential is to supplement these molecules. And fortunately, we have a way to do that today.
That's pretty fascinating right there. Yeah, you're right. Fortunately,
there are no nutritional supplements, William, that will actually cause us to make more of these molecules. It just doesn't work that way. You can't, it would be the holy grail to have what you would call mitochondrial biogenesis from something other than exercise. There are no nutritional products that do that. Certainly, if we are taking supplements that improve our overall health, we can exercise then and then create more mitochondria and thus more redox molecules in proper balance.
Fantastic. So what you're saying is, as we age, we're going to lose about 10% production of our mitochondria, which in fact relates to about a 10% reduction in the signaling potential in the body.
Mm-hmm.
And so are there other examples where we could potentially lose more than 10%? Like, I've heard it's said that because of the toxins in our environment and the challenges with some of the foods that we eat, would that impact it even greater?
Yes. Yes, absolutely. Yes, is a yes answer. And so since the 1970s, roughly, America, just to pick our country for example, we've had a decline in our health. If you look at the statistics from the CDC about obesity, about the development of diabetes, other degenerative diseases, they just continue to be prevalent. The number one killer is still heart disease, despite wide advances in technology. We're still falling out of balance. So the problems of having degenerative disease is actually present when we have sluggish cells and when we have poor signaling between cells. So this is where redox molecules come into play. There's kind of two basic categories. One, these molecules are critical in the communication between cells, between organ systems, connecting the dots in our body, so to speak. If you don't have an abundance of these molecules in proper balances, cells don't get the message. The best example is if you step on a thorn and introduce some toxin or a bacterium into your foot, there's an immediate reaction by the immune system called an oxidative burst of redox molecules, which then signals to the immune system, hey, there's a problem here, send out the troops. Failure to do that can result in septic death. And so that's the worst case scenario, obviously. But we heal from little cuts and wounds better when we're young, less efficiently as we age. And so the signaling component is critical. This goes on even greater. So when we have hormone systems and neurotransmitters from our brains, and all of these signaling setups require these molecules for the communication to occur. That's how critical this is. So it's not a wonder that there's more and more people with hormone imbalance, even at younger ages of 20 and 30 and 40, both men and women, because they just don't have the metabolic balance or the cellular connections to make this happen. So that's kind of part one. Part two is that in our bodies, when we burn fuel, we create waste. We have toxins and waste we have to get rid of. And so the process of detoxifying our cells and getting rid of waste is promoted by chemicals called antioxidants. Well, we make those in every cell of our body. The nucleus of our cells manufactures these little antioxidant molecules. They go by various names. But without these chemical constituents we just call redox molecules, antioxidants can't do their job. So regardless of whether you're making them, which could be promoted by a healthy diet and various supplements to help motivate the nucleus to make the antioxidants, your cells can't clean up the mess without the presence of redox molecules to activate the work of an antioxidant. Think of an antioxidant like a molecule that requires a certain kind of molecule to neutralize the toxins. So when they grab a toxin, they have to have the opposite charge molecule to be able to neutralize it. And so without that other molecule, the antioxidant is just sitting there looking very pretty, but not doing any work. So these molecules are like critical in being able to just do something so simple as clean up the waste from burning fuel in our cells. So we have more energy when we have clean cells. If you have a thyroid cell that's toxic and doesn't feel well, it's not going to make any thyroxine because it's too tired. just doesn't feel like working today. And not to mention the fact that it may not be getting any signals to say, get busy, start working, make some thyroid. So it's no wonder that being able to have this balance of redox molecules in our body, being able to supplement these molecules, is such a critical foundational thing. It's very, very upstream. And when we get to the root issues in our health, things downstream start working really, really well. And in my medical practice, every day, somebody will say, well, what's really the cause of all these problems I have? What's at the heart of the matter? And my answer is always, well, ultimately, it's about balance in your biochemistry. And that most critical piece of that is the presence of these molecules to be able to help carry out all these chemical reactions that are occurring millions of times a second sometimes.
Wonderful, wonderful. So can we say, Dr. Ward, that these molecules enable us to get to the root of where the issue ultimately begins?
Yeah, it's sort of like that. In fact, it's even deeper than that. What people don't realize is that most of our DNA in our bodies is subject to switching. It's called variable penetrance. So, you come equipped with all this DNA in our body, and 5% roughly is fixed. Your eye color and a few other odds and ends. You're not going to change that by being healthier or whatever. But about 90 to 95% of the rest of our DNA is subject to switching. So you either turn on a gene or turn off a gene. And so the beautiful thing about that is that this allows us to adapt to our world. If we're starving and we're only getting bread and water to live on, we have the ability to turn off our metabolism, slow things down, stop making hormones, hunker down and survive the famine. And that is mediated largely by the bacteria that grow on the bread and the water in your gut. Their DNA, through redox reactions, talks to our DNA and dials on or off the adaptogenic gene involved. So it's pretty exciting. So conversely, if we are in balance and having an abundance of these molecules, good nutrition, sleep and exercise and so forth, we dial on our genes that allow us to have the full expression of our biology genetically. So this is the term epigenetics, where it comes from. And at the heart of this epigenetic phenomena are these little molecules making sure that these chemical reactions are working. So coding the production of certain amino acids that will express the genes to help us have healthy coronary arteries and healthy hormone production. All this is directed largely by the molecules that are being activated genetically.
Wow, that's excuse me, that's pretty neat. It makes me think of things I've heard in my life, like the genes you were born with, you will die with.
You're just going to have to live with it.
Yeah, you're going to have to live with it. So
I hear that often from patients who've been told that by other doctors.
Yeah.
And so then what I do is I say, well, that's not true. And they say, well, really? I always heard this. Isn't it just true? No, it's not. And the reason we know it's not is there was a landmark study that was published in the New England Journal of Medicine, the uppity journal that is very well respected. And in 2016, they published a study that was very comprehensive, very overwhelmingly done statistically. They looked at 50,000 case studies of Americans who were studied over longer than 10 years, but they looked at a 10-year window. And they were interested in the coronary artery genes and the expression of those genes or not. Their hypothesis was lifestyle can affect this. But a lot of people said, nah, that's impossible. So they said, okay, we'll prove it. So they isolated 88 genes that they knew coded for heart disease. And they had a whole genetic panel on 50,000 people. And so the first group had every one of those genes. We'll call them group 1. And they tracked group 1 for 10 years. And they said, what's the chance of having a heart event at 10 years? It was 90%. Stent, bypass surgery, heart attack, one of those 3. Group 2 had fewer of those 88 genes, and they had a better outcome, maybe 70% and so forth. They had 4 different groups. So it's very clear these genes would dictate the results. But then they said, we're going to throw in a variable to the equation. We're going to take a subgroup out of group 1 and say, these are the people who are not overweight, don't smoke, eat a healthy diet, exercise regularly. Kind of 4 basic core things. And when people did those core things, they had all the terrible genes. They had a reduction in that 90% risk by 46%. If there was a drug that lowered it by 10%, we'd put Provo, Utah on the map, okay? But this was huge. It raised the eyebrows of the scientific world, and they've never looked back. Corporate world has changed their whole approach to wellness. They now can prove they have saved millions of dollars by investing in wellness programs. But what they don't realize, at the heart of the matter, are really these tiny little molecules that are getting an opportunity to play out in the expression of the genes in a different way. So just to finish my thought, the fun part of that study was that every group, regardless of how bad or good your DNA profile was, every group had the same reduction by 46% in their basic risk, regardless of your genetic makeup. So we have a fair system. You get the same bang for your buck if you live a healthy life. Everybody benefits the same, regardless of your heritage. It's kind of cool.
That is very cool. So literally, we are now able to say our DNA is no longer our destiny.
No, it's not. It is our responsibility to sort of manage the issue. We can manage our DNA. And yes, we might have susceptibilities, but we can impact that by almost 50%, the expression or not.
That's fantastic. That's fantastic. Very
exciting. I mean, who knew? Who knew? So it's exciting times. It's the best time to be in medicine. In my 38 years, I'm never having more fun because I can. We now have tools and tricks and molecules that we can provide to people so that they can restore and replenish their possibilities for expressing their genetic potential fully.
Fantastic. So this is, would you say, Dr. Ward, that this is likely one of the most significant discoveries of our lifetime?
Being able to supplement these molecules is considered to be ridiculous and impossible, but it's not. It is possible today. And the reason is because these molecules are so reactive. They're desperate to exchange electrons. And so they react so quickly. And so to be able to supplement with a stabilized, balanced form of these molecules is wonderful. It's kind of miraculous. And the good news is that these molecules know what to do. It's by design. They know what to do, and our body knows what to do with these molecules and how to put it to work. So I have witnessed in my years involved with this, I witnessed people reacting to these things, these molecules, supplementing these molecules in seconds. They feel shifts in their biology. I can actually document that. And I see people that find changes over periods of months. And I mean, it's changed my paradigm about medicine. I don't think the same way I used to. And I don't tell people they have to live with it if they're willing to do the work of restoring balance to their lifestyle and providing the right resources. So it's a very hopeful thing. And so I have yet to find medical conditions that are, the common degenerative kind of problems we have that don't have a positive response in some way. people who are at the end of life and fighting cancer and various things, my goodness, they find comfort and relief with these molecules. They're in less pain. They're behind the eight ball and they're sinking, but they find that they can function better and they feel better as they are in the midst of a crisis. And then there are, people who have some of the common maladies that afflict us, from blood sugar problems to blood pressure problems. And these molecules are phenomenal the way they can provide resources and make it so that we have choices, whether we need to rely on pharmaceutical products, rely on nutritional supplements. I mean, these all will continue to work just fine when we supplement the molecules, but you may not need the same level of support. It's kind of fun.
It is kind of fun. So what you're saying is that this is going to affect 100% of the people that supplement with it, right?
It's in our biology.
Yeah.
It has to do with our cells. And yes, we don't come with the same genetic fingerprint, but we can dramatically affect that expression depending on how we live and make use of the various resources that are available to us. You can supplement redox topically as well. And it travels across cell membranes just beautifully, penetrates our skin, and it's kind of amazing how powerful that a little bit can do. But that's the nature of our bodies. Sometimes we just need the proper nudge in one little category, and it starts to unravel the whole mess. And those are fun moments when I witness that.
This is great information, Dr. Ward. Can you share your thoughts on? I've had people ask me, will this affect my body's natural production of these molecules or impact?
Great question. Thank you for asking that question, because I've heard that. I thought those thoughts too. So here's the answer. No, it will not change your own production. In fact, quite the opposite. So why would that be? So you would think there might be a thermostat feedback loop or something that would interfere with our continued production. Not true. So we never stop making molecules. Why? Because we never stop creating energy. So when our mitochondria produce energy from food, the ATP that's produced, the natural and normal and continuous byproduct of that production are these little molecules. So if we, it's always on, it's never off. That production process is dialed on, and there's nothing that slows it down except maladies and disease, okay? Or age, as we talked about earlier. So we're always driving to make, it's like oxygen. We need it. We got to have it. We want it. And so we're going to continue to make it. We can add balance to that equation. We can provide more of whatever. But remember, when we have an overabundance of redox molecules, for some reason, the body has a natural way of converting that back into a harmless byproduct of where it came from. So these molecules are made from the saline in our cells, and they convert back to saline when they're done, or the body just returns it to saline. So it's quite natural, and we're always going to be making molecules because we're always going to be making energy. Never stops.
Yeah.
Until we're dead.
Until we're dead.
Yeah.
And without these, we would be.
Well, we wouldn't last very long. It's sort of like air. You got to have it.
Yeah. Got it. So the saline, you brought up saline. So I've heard people have concerns that the saline in it might be an issue for them. What are your thoughts on that?
No, in fact, salt is actually in short supply in most Americans today. Our body regulates our sodium very easily, and except in extreme cases where people have kidney failure or are on dialysis, for the most part, salt is something important for us. The saline that might be present in supplementing these molecules is minuscule and of no consequence. I have never seen any ill effect of supplementing these molecules, never. And kind of makes sense. It's part of our biology. We're providing a native supplement to our body. It's not natural because that might be broccoli. Broccoli is not native to my body. Broccoli is a foreign substance. It has phytonutrients that my body can make use of, but it's separate from me. It stays in my digestive system and is broken down, and some of the molecules are extracted for the purpose of nourishing my body. And that requires redox molecules to do that, by the way. But that's not native to my body. These molecules are absolutely native. They're the same ones that are made inside our cells. And so there's never an allergic reaction or a bad response. Yes, if you start providing these molecules, your body can begin a detoxification process, a cleansing, so to speak, a rebalancing. And as we eliminate the toxins and the various things from our body, sometimes we get hung up and you can feel a little sick from a healing response. But all you got to do is slow down and hydrate your body with plenty of water, good water, and you'll complete the detoxification process.
Fantastic. And would you say that there could be ultimately more than one detoxification experience that you can? Okay.
Yeah, there's layers. We heal in priorities. Our body is wise. It knows where to start and starts doing things with first priorities and second priorities and stuff. They're all happening at once, but like certain ones get the big efforts to critically restore balance, like healing our adrenal glands or something that's very basic to our biology. So yeah, it can happen, but it's for people that understand health and healing. When you see that kind of reaction, it always brings a big smile. Things are working. So let's slow it down. We don't have to suffer. Let's just slow it down and make sure we're getting things released. The most toxins are released through our skin, our lungs, our gut, and our urine. And the biggest problem is our gut, because the lining of the gut can be inflamed and sort of easily allowing for recycling of toxins. So if we're eliminating a toxin through our liver and the bile tract, it goes into the gut. If the gut's inflamed, if the junctions between our cells are not proper, and all these chemicals kind of leak back into the lymphatics, go right back to the liver, you get stuck. And so taking care of our digestive health is a big deal. And if we do that, we have less chances of being stuck.
Fantastic. That's great information. Water, really important to hydrate to move the process along.
William, it's not a coincidence. The earth is covered by 70% water, and our body composition is 70% water. We are just trying to play along with this whole beautiful scenario. And if we don't drink plenty of water, all of a sudden we're 60% and 50% water, and we're toxic.
This has been so amazing. I learned so much. I learned so much tonight, and you've opened the door in a really big way. I think for all of us that are listening, opening the door to realizing that here you are, a medical doctor that's probably more advanced in the understanding of redox biochemistry than perhaps almost anyone. And here you are, extremely excited about what this does to change the world of health. And here we are, many of us are partners in this effort to spread the knowledge around the world. And I know for myself, I feel more empowered. I feel more confident. Not that I need to go out and be the expert like you, but just having the confidence and realizing that, wow, we have something so incredible and so meaningful for the body and the body's ability to heal itself that we should be going to the mountaintops and screaming this.
Yeah. Well, you don't have to be a redox biochemist in order to share the potential of what supplementing these molecules can mean. But you can leverage a resource. And so, for example, the book Healthy Cells, Healthy Life is a great resource to say, well, I don't understand all the chemistry stuff, but Dr. Ward's written this book, and it's pretty easy to read and follow. And I think it may give you a sense of comfort in knowing that the science kind of makes sense, okay? The same thing applies to the next book that I'm writing, which has to do with the way nutritional supplements, our basic nutrition, our digestive health, and redox chemistry. They're all connected, all right? And part of that connection has to do with the way in which the bacteria that live within our digestive system utilize these molecules and empowers them to process nutrients and nutritional supplements properly. So things just don't go right through you, that you get real resources and benefits that can go to work in your body. So stay tuned, that it's another layer of understanding. And I mean, it's kind of crazy how powerful our digestive system is. 80% of our immune system is 1 inch from our poop. Think about that. Now, why would that be? It's all by design. And so we have the capacity to influence our biology, our genetic expression, by how we care for this, what's called the gut microbiome, the genetic fingerprint of the bacterial world in our gut. There's 80 trillion of these bugs that live within us. They're foreign to us. And they change. They live and die every 20 minutes. They have babies. So the ones that grow are the ones you feed, the ones you nourish, the ones you provide resources like molecules to. So anyhow, it's pretty astonishing what's possible. So that's where I put a lot of my day-to-day life in my medical practice, has really been more recently focused in the past 5 years based on the new science that we've had on helping people maintain that vibrant microbiome balance. The people who are really in trouble, William, really seriously in trouble, who have failed medical therapies and so forth. In my county in Utah, this is Utah County, it's a big county. There's 20 to 30 people every month who are getting fecal transplants to try to restore this microbiome in a dramatic way. And they get results. Their insurance company will cover these things because they work. And the science is solid, and we're doing this more and more because people really have problems here. And so our typical American diet is not always conducive to maintaining a healthy gut balance. So anyway, stay tuned. We'll be talking more about that stuff.
Dr. Ward, you know, it's been so great having you on today. It's just a treat. And I know we had nearly 200 people on with us tonight. And I know many, many more, probably in the thousands, will see this. And I know it's going to be a huge help for all of us. Do you have any final thoughts you'd like to share with us? Absolutely. I think that in life, as we seek to be of service to one another, the most important thing we can do in that journey is to listen and to do our best to understand. As we do that, we can sometimes be of service by saying, you know, I understand what you're feeling, and I have felt some of those same things before. And here's what I have learned in my own journey. It may be helpful to you. And people can witness the truth of that in you. You don't have to be an expert, a scientist. You don't need anything. You just need to be sincere and genuine in your desire to help others. I do that all day long in my medical practice. I just truly try to listen, think, and find ways to solve problems. And so you don't have to know a lot. You just have to care. And if you
just have exercised some faith that the human body knows how to take care of itself, provide a natural, native supplement that works at the headwaters of our cellular metabolism, you will make a difference. You won't hurt anyone. And you may very well be an answer to prayer. So I just encourage people to open their mouths, be kind, and listen, and good things can happen.
Dr. Ward, thank you so much. Jim, do you want to jump in?
Yeah, I was going to ask you, Dr. Ward, about athletes, and then also why a lot of children seem to be getting sicker younger. Could you maybe touch on those two topics? Why does it work amazing with athletes, and then also the children? And the children are seeming like they're getting sicker younger.
So athletes are very wise and understand their bodies because they take their bodies to limits, the outer limits of their performance. And because of that, their bodies have to do some recovery. And the speed of recovery is what athletes pay most attention to. They can push, push, push. If they can recover and gain power, they're going to win, and without getting hurt. So micro trauma is a big issue for most athletes. And so the micro traumas add up, and all of a sudden you have an injury. So what athletes experience is a shift. They can feel this. These molecules will help them in repairing from the oxidative stress or rust that comes from burning a lot of fuel and creating a lot of waste. And the body needs a little extra help in dealing with that sometimes. And that's what supplementing these molecules can do. So that's part one. Part two, young people today have inherited the microbiome message from their mother. And many kids today are starting at a disadvantage because the transplacental and birth canal spread of the mother's microbiome to the baby is maybe deficient. And so they're starting at a lower point than the previous generation and the previous generation. So we see a decline in the diversity of the bacterial world in our gut, which is so critical in our genetic expression. So it's a decrease in diversity, and some of that is hard to ever recover. So that's the most important gift we pass on to our children, is that here's my world, here's my microbiome fingerprint I'm giving you as a newborn, and there you go. Go forward and be prosperous, or not. And so you combine that with foods that are oftentimes very nutritionally deficient, foods that are toxic, and just plain out causing the growth of bacteria that are only good for survival, not being prosperous. And kids are suffering. They have vitamin deficiencies very young in life, both fat-soluble and water-soluble vitamins in their teens. And it's hard to repair. So that contributes to poor health in general. And an epidemic of diabetes in their teens that should be not happening until 50, right?
How do you talk to people? You see people when they come see you, they're ill, correct? They're not feeling well. How do you talk to people about prevention? Because, the majority of people honestly don't care about their health until they have a health crisis. We try to reach people before they get to that point of having their health crisis. Are there any words of advice you would have for us on just sharing this with people and making the importance of prevention is critical? Because our medical system is going to change. I was an ex-stockbroker, and I understand how a lot of the financial stuff is going to work. There won't be the money there to pay for a lot of the medical procedures later on that we can maybe address today, correct?
Right.
By supplementing the molecules.
Well, the people who show up in my office oftentimes are there because of a sickness, but they're always wondering what they can do to help prevent this in the first place. And so what I tell them is this. They are the captain, or more appropriately, they're the pilot of their own ship. And they got to steer that boat the best way they can. And it's their boat. It's not the doctor's boat. It's their boat. Your health is your responsibility. There is no prescription drug for health. There are prescription drugs for disease. Health is your business. It's your decisions. You're the pilot of that boat, and you can drive it whichever way you want. If you're reckless and disregard basic rules, you will crash. It just happens. And yes, you may be able to pick up the pieces, but it's not going to be the same. The boat's all scratched and dented and beat up. It may float, but it's not looking very pretty. So we get to choose. And that's why I just tell people, if your decisions about health are your own private matter, not your doctor's. And because most doctors are focused on treating disease and diagnosing disease. But health has nothing to do with that. Health is more foundational. It's underneath of that. And we won't see the expression of disease, degenerative disease, if you are in a vibrant balance, especially your redox potential.
Fantastic.
So listen, it's been good to be with you. I got to run. I've got an appointment to get to.
All right. Dr.
Thanks for having me on, you guys.
Thank you so much.
Thank you. God bless. Thank you, Doc.
Have a good night.
So long.
Thank you.
Guys, like Dr. Ward said, all we need to do is want to help. All we need to do is want to make a difference. And go out and make a difference, because everybody does deserve to know about this. Okay? So, Jim?
William, I loved what he had to say about we just need to listen to people, because we're so eager to want to tell everybody what we have, but we need to listen to them first and listen to what they're concerned about, what their worries are. And then we can help them, right? But we're so eager to jump in and offer solutions. And I will say, too, if you are an invited person, please get back to the person that invited you to this call, and they can tell you quite a bit more about how to join our global mission to help people throughout the world. So with that, thank you, guys. Appreciate it.
Awesome.
God bless. Thank you, William.
You bet. See you later.